Hello, my name is Dr. John Stone. I'm a rheumatologist at the Mass General Hospital and a professor of medicine at Harvard Medical School in the United States.
My name is Dr. Shauna Quinn. I'm a clinical scientist at Zenas Biopharma. We at Zenas have committed our support to Dr. Stone to help the IgG4-related disease community. Although our community is learning fast about your disease, an area of unmet need is patient education. And that is what all this effort is about.
If you're watching us today, you or someone you know has IgG4-related disease. In this short series of videos, we'll give you information about IgG4-related disease that may be relevant to you. We will start with what it is, who gets it, and what constitutes a disease flare.
IgG4-RD is an uncommon disease, but one that is certainly not vanishingly rare. It is classified as an orphan disease, which is defined in the United States as a condition that affects fewer than 200,000 patients. IgG4-RD is thought to have an autoimmune basis, meaning that for reasons that remain poorly understood, a patient's own immune system has become intolerant to one organ or another, leading to an inflammation in that affected organ or organs. We'll discuss more about the specific type of organ involvement in the near future. IgG4-RD appears to be more common in men than women, but can affect anyone of any race. It is typically diagnosed in adulthood, but IgG4-RD has been known to affect children as well. The epidemiology of IgG4-RD remains poorly described at this point, but the best estimates using currently available information is that perhaps 40,000 individuals in the US have this disease. That is about 1 in 8,000 people. The number of patients worldwide remains unclear. There is little doubt, however, that a large number of cases remain undiagnosed. I suspect that we will learn a lot more about the epidemiology and demographics in the next few years. IgG4-RD is characterized by fibrosis and inflammation. Fibrosis is similar to scar tissue, like the severe skin injury to the chest that eventually scars. You cannot see the scarring of most of the organs inside your body, but a few organs like in the head and neck are more readily visible.
IgG4-related disease causes inflammation and fibrosis, which can occur in many different organs in the body. What your disease feels like and how your disease progresses depends on what organ is impacted. IgG4-related disease can literally attack any organ in the body, but it has a predilection or tendency to affect 10 or 12 organs most commonly. It can affect just one organ at a time, but frequently affects more than one organ simultaneously. The most commonly affected organs are the pancreas and the bile ducts within and outside of the liver, the major salivary glands of the head and neck, the lacrimal glands, the lungs and kidneys, and the orbits, which is the region around the eyes, particularly the muscles that move the eyes. Other commonly affected organs are the retroperitoneum, blood vessels, including the aorta, the covering of the brain and spinal cord, known as the meninges, and the prostate gland. Another patient with IgG4-related disease might have a very different experience from you. Most patients with IgG4-related disease require treatment to prevent worsening of their disease and injury to their body. Without treatment, the disease typically continues to get worse and can potentially spread to other parts of the body. Even with treatment, IgG4-related disease is usually not curable, but continues to progress over time. The message that I give to my patients is that IgG4-related disease is manageable and that working together, we can ensure a full lifespan and a normal quality of life. IgG4-related disease attacks organs in waves that come and go. These waves are called flares. The flares can impact your organs and cause you to feel symptoms. For example, a flare in the pancreas might cause severe abdominal pain, or a flare in the salivary gland, such as the submandibular gland, might cause new or worsening swelling on the face or below the jaw. Here I show the effects of these repeated flares in the pancreas. Eventually, the pancreas scars in a process that we call sclerosis. Your doctor will do his or her best to control each flare. Disease control is important because the risk for scarring increases with each flare. A big challenge in IgG4-related disease is that the disease is often subtle. Before diagnosis, many patients do not even know that they are sick before their organs have developed major damage. Eventually, your organs can become too damaged to function normally. In future videos, we will discuss symptoms and treatment of IgG4-related disease based on which one or ones of your organs are affected. IgG4-related disease was recognized as being a unique disease only in the first part of this century, barely 20 years ago. That's right, the disease wasn't recognized as being an individual disease entity until 2003. There therefore remains much to learn about this condition, but we are learning fast. We hope to provide information useful for you to live with your disease. Please refer to the links in our video description for a list of patient advocacy groups, clinical trials studying new therapies, and other patient resources. Thank you for watching, and I hope to talk with you again soon.